Like something that won't stay dead, Trumpcare continues to come back, only to be put down and delayed over and over and over again. Now, CNN is reporting that House Republican leaders on Thursday tried to bring back Trumpcare for a vote, but since they didn't have enough votes, ended up delaying the bill till at least next week at the earliest. Now, that's important because tomorrow will mark Donald Trump's first 100 days in office. He really kind of wanted this victory. He really kind of wanted something to show for, hey, this is what I did in my first 100 days in office. Well, he's got nothing. Sad. Now, according to GOP lawmaker Speaker Paul Ryan and his top lieutenants had decided that they do not have enough votes to stall the zombie healthcare legislation. At least 15 Republicans remain solidly opposed to the bill, with another 20 leaning no or still undecided. Now, of course, House Republicans can only lose 22 votes. So there's about 35 people, 15 solid no's, 20 maybe no's, or leaning no's. That's, man, they still need a lot of work. So now, House Majority Leader Kevin McCarthy told reporters saying, quote, "We are not voting on health care tomorrow. We are still educating members." Well, okay, well, hey, that's what you want to call it, educating. Oh, we're educating voters. Or, I'm sorry, we're educating members. What's there to educate them on? They don't like this bill. I'll get into the reasons why, of course. Now, White House officials, after striking a deal with conservatives, had raised expectations that the vote would occur this week. And they privately pushed Ryan to hand Trump something he could tout as a major legislative victory before Saturday. Now, unfortunately for them, and fortunately for everybody else, they were unable to do so. They were unable to come to a consensus. Now, what are they fighting over? Well, it turns out they're still fighting over protections for pre-existing conditions. Now, you have Representative Ryan Costello, and he is a so-called centrist, moderate Republican who's indicative of the one side. You've got the moderate, so-called moderates on one side, and then you have the people like you have the Freedom Caucus over on the other side, and they're essentially disagreeing on how far to go in this health bill. Now, Ryan Costello said, quote, "Protections for those with pre-existing conditions without contingency and affordable access to coverage for every American remain my priorities for advancing healthcare reform, and this bill does not satisfy those benchmarks for me. I remain a no vote in this bill in its current form." Now, you also have multiple senior House Republicans. Sources said Ryan and his top lieutenants have made progress and are increasingly confident they'll eventually garner enough support to force the bill through the chamber. They've locked down the most recalcitrant conservatives in the 238-member House conference and say that they are making headway with some moderate Republicans wary of a constituent backlash if they support the healthcare overhaul. Now, remember, again, this is the Freedom Caucus versus the so-called moderate Republicans. Now, they think, the Freedom Caucus does, they think the AHCA is too generous towards poorer and sicker people, and they actually want to eliminate popular provisions like protecting pre-existing conditions. They want to stop the protections, turn them over to the states, and say, hey, if you want to protect them, great. If you don't, great. Also, we're in favor of high-risk pools. Well, I'll get to that. Now, on that, though the measure would technically preserve Obamacare's guaranteed coverage for people with pre-existing conditions, it also allows insurers in those states to jack up premiums for sick people if they have a gap in coverage. To offset that risk, the bill includes a $130 billion fund meant to keep premiums down for people with pre-existing conditions. That is sort of like a high-risk pool. Now, how did those work? Okay, like, how did they do? Because we've tried this before. Now, Minnesota had what was called the most successful high-risk pool in the country before the ACA. Well, let me tell you a story about how successful that was, because they have a different measure of success than I think other people do. Now, this is a story of Craig Britton of Plymouth, Minnesota. Now, he once had a plan through the state's high-risk pool that cost him $18,000 a year in health insurance premiums. 18 grand a year just for insurance, just to pay his premiums. That doesn't have anything to do with deductibles and you know, the co-pays and any of that. No. Just premiums. That is ridiculous. Now, Britton said he was forced to buy the expensive MCHA coverage, that's what they called it in Minnesota, because of a pancreatitis diagnosis. He calls the idea that high-risk pools are good for consumers, quote, a lot of baloney. That is catastrophic costs. You have to have a good living just to pay for insurance. Wow. Now, Stefan Guildmeister, an economist with Minnesota's health department, said, quote, it's not cheap coverage to the individual, and it's not cheap coverage to the system. So the whole idea that these high-risk pools are going to save money, well, it's bullshit. It's bunk. And this is based on evidence to places that have actually tried this, okay? MCHA's monthly premium costs cost policyholders 25% more than conventional coverage. And that left many people uninsured in Minnesota. And of course, when you don't have people that have insurance that can't afford premiums, well, that jacks up the price for everybody else. And furthermore, makes it even more unaffordable. And less people are covered. Now, there were people out there, Gildemeister says, who had a chronic disease and had a pre-existing condition who just couldn't get a policy. Now, aside from being a disaster for those people, it was also a disaster for everyone else. Even people who had insurance who were healthy. Even the higher premiums fell short of covering the full cost of care for the roughly 25,000 people who were insured by the program. It needed more than $173 million in subsidies in its final year of normal operation. Now, where do you think they got that money from? Well, they got it from you. Through fees collected from private insurance plans, which essentially shifted a big chunk of the cost of insuring people in MCHA programs to people who get their health insurance from work. So, again, those people, the people who have insurance through work, well, they ended up paying more for the subsidies to go into these high-risk pools, which were still, for many Americans, unaffordable. Gildemeister ran the numbers on what a return to the MCHA would cost. If they get those health pools, those high-risk health pools back, annual risk pool coverage for a 40-year-old would cost more than $15,000. The policyholder would pay about $6,000 of that, and subsidies would cover the more than $9,000 remaining. So either way, you're going to have an incredibly high cost for taxpayers. So that's what we have here, okay? And this is why people, they don't want high-risk pools. This is why they actually want to keep the ACA and fix it. And look, over 70% of Americans, according to a recent ABC News Washington Post poll, said that they want the federal government to mandate that people with pre-existing conditions not be denied health insurance coverage. They flat out deny the idea of kicking people off insurance for having a pre-existing condition and replacing them and putting them into a high-risk pool. They reject that idea because they know from experience that it doesn't work, that these high-risk pools are more expensive and they don't actually save anybody any money. Now, the American people, turns out they don't want your stinking Obamacare repeal. They don't want your zombie of a bill. What they want to do is they want to put it out of its misery. And they want to fix the ACA. Over half of Americans say, 64% I believe, want to fix the ACA. And many more Americans want to expand Medicare for all. You even have a majority of Republicans. 48% of Republicans want Medicare for all versus 36% who want to stay with our markets-based system. They do not want what the Freedom Caucus is selling. And of course, among Democrats, 81% of Democrats want a Medicare for all system. That's what we want. We want Medicare for all. Get it through your thick skulls, Republicans. The American people They don't like your stinking policies. They don't want your free market health care. What they want is they want universal coverage at an affordable price. That's what they want. And the only way to really do that is Medicare for all. And now the people are starting to catch on. Get with the program, Republicans. Support Medicare for all. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.